Hey everybody, welcome to another episode of The Bitter Pill. So today I just wanted to do a very brief video explaining some of the statistics from clinical trials of COVID vaccines. And the reason I wanted to do this is that I came across this misunderstanding, which I suspect is common with somebody who was responding to comments of mine on Twitter. So somebody who was opposed to the vaccine said, I am choosing not to get the COVID 19 vaccine for personal reasons, and it doesn't mean I care any less about myself and others. Please don't judge me or think of me as a bad person for not getting it. I'm not judging you, it's a personal decision. Aloha. Well, I mean, as long as somebody who doesn't get the vaccine is, you know, careful about social distancing and wearing masks and so forth, then okay, I guess. And obviously, if somebody has medical reasons why they can't get it, then that makes sense. But it's not really true that it doesn't affect other people if you don't get the vaccine. Just like it's not true that it doesn't affect other people if you do other things that increase your risks of getting COVID and possibly passing it on to other people. Anyway, um, it is certainly possible to just stay away from people or wear a mask when you're around them and not have much chance of transmitting them. So I guess that's true. But anyway, someone responds, you're not harming anyone by not getting it since it doesn't even prevent you from getting it afterwards. Well, definitely not true. Um, Obviously, no vaccine is 100% effective. Getting vaccinated doesn't guarantee you that you won't get COVID or whatever disease the vaccine is for. However, as I pointed out in responding, more than 90% fewer people got it in the Pfizer, Moderna, and Sputnik clinical trials of those three vaccines. Oxford, AstraZeneca, and Johnson & Johnson efficacy was more like 70%, but they were tested under circumstances where there was a high rate of population infection with much more contagious variants. So, for example, the Johnson & Johnson vaccine was tested in, for example, Brazil during a period when they had a much higher rate of infection going on than was the case during the uh, summer and early fall when the Pfizer and Moderna clinical trials were run here in the United States. So you would expect if people are more frequently exposed to the virus, that it's more likely that somebody would get infected. Um, so, in any case, somebody responded reflecting a misunderstanding of how these clinical trials work and what the statistics mean that I suspect might be common. She said the 95% effectiveness rate for the Pfizer vaccine was based on 170 people. Did you know that? So, essentially claiming, well, there were only 170 people in the combined, you know, vaccine and control groups that got infected. So, how can we know anything from only 170 people? Well, here's how we can know that. So I responded, the study was of over 40,000 people. 170 of them got COVID, 162 in the control group, and 8 in the vaccine group. So that's how they came up with a 95+% efficacy rate. It's statistically almost impossible for an event to happen just by chance. Only 8 out of 170 in one group versus 162 in the other group. And that may not be intuitively obvious to you, but think about it this way. If you flip a coin 170 times, how likely is it that 162 of those times it comes up heads? That's the odds we're talking about here. If you have a fair coin, it's extremely unlikely that you're going to get 162 out of 170 heads. And similarly, if you've got a vaccine that doesn't work any better than saline solution, it's not effective, then, you know, the odds that you would have only 8 people out of 20,000 getting infected with COVID who got the quote unquote vaccine, whereas 162 people got infected who got the placebo, the saline solution, uh, that wouldn't be very likely to happen just by accident if the intended vaccine really didn't work. How unlikely is it? Well, we can actually calculate that with a statistic called a chi-square statistic. So I already entered the data in here. What we observed out of those 170 cases of COVID in the 40,000 plus person Pfizer clinical trials, 8 people who got the vaccination got COVID. And by the way, none of them got a serious case. They were all mild. 162 people in the control group who didn't get the real vaccine got COVID. Now, if things were just chance, then the most likely outcome would be, an even split, 85 in each group being infected if it was, 170 people overall. Okay, so how likely is it that we get 8 versus 162 rather than 85? Just by chance. Let's calculate it. Turns out that there's a less than 1 in 10,000 chance, actually quite a bit less than 1 in 10,000, I'm not sure by how much, that this event could happen just by chance. So, the clinical trial suggests very strongly that this vaccine is effective. And okay, well, let's look at some of the others. Just to save some time here, I'll just point out in every case, probability of less than 0.001, less than 1 in 10,000, that the two groups could have differed as much as they did. The group that got the vaccine versus the group that got the placebo saline solution could have differed as much as they did just by chance. So just to briefly scan through the data, the Novavax vaccine, which I forget where that's made, they had 15,000 participants in their the first phase of their clinical trials, randomly assigned them to get either the Novavax vaccine or placebo. 56 COVID cases in the placebo group, only 6 in the vaccinated group, for a 90.3% efficacy rate. The only severe case was in the placebo group, one of these 56. The Sputnik vaccine developed in Russia, they had 19,866 participants in their clinical trial. They found 16 cases in the vaccinated group, 62 in the placebo group, but they made the vaccinated group 3 times as large as the placebo control group. I guess they figured, a little under 5,000 was enough for the control group, and they want to give as many people as possible the vaccine, I would assume, before the end of the study. So that's why they made the vaccinated group 3 times as big. So anyway, 91.6% efficacy rate. The Moderna vaccine, one of the other ones being given here in the United States, 30,420 participants in their clinical trial. They had 11 cases of COVID, 11 positive COVID tests in the vaccinated group, 185 in the control group. that works out to a bit over 94% efficacy. And Johnson and Johnson, uh, which was tested in a very tough environment in, for example, Brazil and South Africa, when they had highly contagious variants going around and they had high infection rates. So you'd expect, under those circumstances, the vaccine might not work as well at preventing people from getting COVID altogether. And so they did, in fact, have 116 cases in the vaccinated group, a lot more than in the other uh, clinical trials with the other vaccines. 348 in the placebo group, so a lot more cases overall. Um, actually, yeah, like more than twice as many as in the Pfizer clinical trial, even though they had about the same number of participants. So only 66.9% efficacy, but still, no doubt that these two numbers are different. Nice small probability there that this difference could have happened by chance. And again, as with the others, no severe cases of COVID in the vaccinated group. So anyway, I hope that makes clear to you, how these clinical trials work. We'll be getting more data on how these vaccines are working as we go along, but right now the early results are encouraging. There aren't really any countries where uh, almost everyone's been vaccinated, but Israel has fully vaccinated 55% of its population, and their COVID case rates have plummeted by over 90%, and death rates as well. Uh, Similarly, in the UK, about 50% of the adult population has received uh, one dose so far of the vaccines that they're using, and they have had similarly more than 90% declines in case and death rates. The UK also had a strict lockdown and travel ban in place, so that certainly accounted for some of the change as well. Um, but in the United States, as I talked about with my colleague Bob Sinclair the other day, uh, the one group that's been highly vaccinated is nursing home residents. And in that population, we've seen uh, well over 95% declines in rates of COVID cases, well over 90% declines in COVID deaths since their peak back in December. So, anyway, that's where we are with the data on the efficacy of vaccines at this point. I will see you next time. Please like and share and subscribe, and we will meet again soon.